is stopped by it. The skeletal structure of the larynx. The larynx consists of cartilages and the membranes, and these will be the structures that we are going to be discussing now. Let me set up a few things. So the larynx, it consists of cartilages. These cartilages are six named cartilages. Three of them are unpaired and three of them are paired. And it consists of membranes. These are extrinsic membranes that are joining the larynx to the external structure that include like thyrohyoid membrane, hyoepiglottic membrane, then there is cricotracheal membrane, cricoid and trachea, and then thyroepiglottic. These are from the thyroid cartilage to the epiglottis. So these are extrinsic and intrinsic, consist of two membranes. These are quadrilateral membrane and cricothyroid and cricovocal membranes. So we will be going into the detail. Let me set up the 3D model. Okay, so here we are. So this is the skeletal of the larynx. It is made up of three unpaired bones. Let's look at them first. This large bone, this large cartilage that is making most of the outer covering of the larynx, this is thyroid cartilage. This is the anatomical position of the larynx. Let me get it a little straightened up. Okay, let me reset it. Give me a second again. Back to it. So this is the first unpaired cartilage, thyroid cartilage. This is a big one. You can see it from either side. It is covering the outside of the most of the larynx. We will go into the detail. The second one is this cricoid cartilage. This is the cricoid cartilage. It is again a single cartilage. It is forming a whole ring. Actually, interesting thing is that it is the only complete ring of the respiratory tract. Below it, the tracheal rings are C-shaped. Above it, thyroid cartilage is not covering from either side. Cricoid cartilage is the one that is a complete ring. And then we have this epiglottis. We have epiglottis. These are the three cartilages that are unpaired. Then let's look at the paired cartilages. These are okay. Okay, let us look at here. So there are three pair of cartilages. You can all see three of them here. This is a pair of arytenoid cartilages. These are triangular shaped cartilages. These are arytenoid cartilages. On the top of the arytenoid cartilages, here are the corniculate cartilages. They are present on the top of the arytenoid cartilages. This one and this one. These are corniculate cartilages. Not attached with the rest of the cartilaginous skeleton. This is cuneiform cartilage. These are present in this membrane, that is quadrangular membrane, membrana quadrangularis. We will be discussing it shortly. So these are the cartilages that are present here. Thyroid cartilage unpaired, cricoid cartilage that was unpaired, then there was epiglottis that was unpaired, then three paired cartilages. There is arytenoid cartilage, corniculate cartilage, and a pair of cuneiform cartilages. So these are the cartilages. To talk about the membranes, so there are two sets of intrinsic membranes. This is the one we will be talking about, quadrangular membrane on either side, and then we will be talking about this membrane. This is cricothyroid. It has further two parts. We will be talking about anterior and lateral parts. This is the anterior part. This is going from cricoid to thyroid cartilage, and its inner aspect is going all the way to the vocal cords. So this is also known as cricovocal ligament. And there are ligaments that are connecting to the outside, like thyroid cartilage to the hyoid bone, thyrohyoid membrane, its midline part, median thyroid ligament. And if we look from the outside, the ligaments that is joining hyoid bone to the epiglottis, and the ligament that is joining, it is counted as the extrinsic ligament, the ligament that is joining thyroid cartilage with the epiglottis. So these are the ligaments that we will be discussing. And of course, there is this cartilage also, the cartilage that is joining the cricoid cartilage with the trachea below. So it is a complete ring of cartilage. This is complete ring of membrane that is joining these two structures. So these are the membranes and the cartilages that are forming the skeleton. So this is the overview of the skeleton of the cartilage. And then there is a thing about their histology. The thyroid, cricoid, and especially the upper half of the arytenoid, these are hyaline cartilages, at least partially arytenoid. Epiglottis, corniculate, and cuneiform. I'm sorry, this is the lower end of the arytenoid. Thyroid, cricoid, and lower end of the arytenoid, these are hyaline cartilages. And the epiglottis, corniculate, cuneiform, and maybe the upper part of arytenoids, these are elastic fibrocartilages. Thyroid cartilage. Let us talk about it here on the 3D model, then we will revise there also. Let us isolate it. This is the thyroid cartilage. Thyroid cartilage consists of two large surfaces. These are the lamina. This whole plate is the lamina of the thyroid cartilage, and on the lamina, on the anterior aspect, the border where the two lamina meet, this line is known as anterior border or median angle. This line is the median angle, and on the top of the median angle, this point is known as thyroid notch, superior thyroid notch. This part that is on the top of it. In males, in genetic males, you can see this median thyroid angle, this hanging out outside the neck. The males, the genetic males who have matured sexually, usually they have this prominence, the thyroid cartilage, this median angle, laryngeal prominence. This is known as Adam's apple. Adam's apple is not so much a medical term. Median angle, laryngeal prominence is the angle, name the thyroid notch. The posterior border, if we look at it, it consists of two raised area. The horn that is raised above, the horn that is raised below. These are known as superior and inferior horns respectively. And then if we look at it, the inferior horns are the ones that are responsible for making the joint with the cricoid cartilage. These will have articular facet on the interior aspect. These will be responsible for making a joint with the cricoid cartilage for the cricothyroid joint. And then we are left with this line. This line that is going, this is known as the oblique line, oblique ridge, and on both the ends, on the both ends of the oblique ridge, there is a raised area here and there is a raised area here. Both will be known as tubercles of the oblique line. So this is about the thyroid cartilage. Just let me set one thing. So this is about the thyroid cartilage. We have talked about this lamina, anterior border, superior notch, also known as laryngeal prominence or Adam's apple. It is due to the story of the Adams and Eve. They have said that the apple was stuck here. That is why the males have a prominence right here. There is a posterior border with superior horn, inferior horn, and there is an oblique line with the inferior and superior thyroid tubercles. This is the Adam's apple. The cricoid cartilage, it's a signet shaped ring. Let us look at it here in the 3D model. This is the cricoid cartilage, this one. If we isolate it from others, this is like a signet ring. It has the posterior part that is raised and anterior part that is called lamina. It is forming the foundation of the larynx. It is forming the base of the larynx. It will have the place for two joints on its sides. It will have a placement for the articular surface for the joining of the inferior horn of the thyroid, and on the superior aspect it will have a surface for the arytenoid cartilages. These will be placed on the top of it, so it will have a placement for that. On the posterior surface there will be two fossae like here and here, and between them there is a median ridge, and they will be giving rise to the muscles, posterior cricoarytenoid muscles. We will discuss them as we reach the muscles. And then there is a ring, there is a lamina that will form the ring around the rest of the cartilage. This is the cricoid cartilage. Talked about the foundation of the larynx, signet shape, only complete ring in the respiratory pathway. The lamina is the posterior expanded part. The anterior arch is the arch. The lamina has the articular surfaces on the top, arytenoid cartilages on the side for the cricoarytenoid, and on the back there is a median ridge with fossa on the either side for the posterior cricoarytenoid muscles. So this is about the cricoid cartilage. Then there is epiglottis. It is a curved leaf-shaped structure, and it is a attachment. It is relatively freely hanging. I'm talking relatively because it has a lot of attachments. It does not attach to the skeleton with each side. It is only attached to the skeleton of the larynx through this ligament that is known as thyroepiglottic ligament, and it is attached on each side to the it is attached to the hide bone to the front, and it has a lateral attachments to the hide bone also. So these are known as hyoepiglottic ligament. If I isolate this ligament, is this muscle, this not muscle, this cartilage, this is a leaf shape. This surface that is on the anterior aspect that is directed towards the oral cavity, that will be the oral surface, and the one that is on the back side, that is the laryngeal surface. And larynx, it has a tendency to fall back onto the larynx when you are swallowing, and it acts as the gatekeeper. It acts as the lid of the larynx. When you are swallowing, it goes back, it covers the laryngeal inlet, and it uh, protects any food particle from coming inside. This is about the epiglottis. And posterior surface is pitted as compared to the anterior surface, and the anterior surface has the epithelium that covered by epithelium that is similar to the oral cavity, and posterior surface has an epithelium that is similar to the respiratory pathway. We will discuss that. There is a catch in that. It is not complete information. In the midline, it is connected to the base of the tongue with median glossoepiglottic folds, and on the lateral aspect it has the lateral glossoepiglottic folds, and in between them there are fossae known as vallicula. Again, we will discuss them again when we will be discussing the interior of the larynx with the with the membranes. Arytenoid cartilage, it's a pyramid shaped cartilage. It is a three-sided pyramid. Its inferior surface is the one that is lying on the top of the cricoid cartilage. It will have three projections: the one that is on the top apex, the one that is on the anterior aspect, and the one that is raised on the posterolateral aspect. This one, the one that is on the top, that is known as apex. It gives the placement place for the corniculate cartilage. It gives placement for the corniculate cartilage, and the one that is this is the arytenoid cartilage. This is the lateral process, posterolateral process. It will give attachment to a muscle, set of muscles. We will discuss them. And this will have this anterior point. You can see this point. This is the vocal ligament, as it is giving attachment to the vocal ligament in front of it. So it has three surfaces. The one surface that is on the back, you can see. The one surface that is on the medial surface. There is a lateral surface right here. These are the surfaces, and the one that is inferiorly, that is helping in making of the joint. So this is about arytenoid cartilage. This is the isolated right arytenoid cartilage. The posterior inferior, the apex, the vocal ligament, the posterior surface, the lateral surface, the medial surface, and the inferior surface that is forming the joint. So this is about the arytenoid cartilages. On the lateral surface, it will have depressions. The one above it will be for the vestibular ligament, and the one below that will be for the vocal ligament. Corniculate and cuneiform cartilages. These cartilages are present. These are very small. These are present on the top of the arytenoid cartilages. The ones the ones on the top of the arytenoid cartilages are known as corniculate, and the ones that are actually embedded in the membranes, these ones, these are for known as cuneiform cartilages. So they are shown right here and right here. So these are corniculate and cuneiform cartilages. This is all about the skeleton, the joint.